I'm Viki Kalatzis. I work at the Institute for Neurosciences of Montpellier in France, and I direct the Vision team, and our work is aimed at studying inherited retinal diseases, going from understanding the genetics through to pathophysiology and through to developing therapies. And choroideremia is one of the subjects we've been working on for many years now, for about 15 years. So my first conference was in 2008 in Baltimore. And then I attended them regularly up to 2014, and then I think I missed a couple, and then COVID, and then I'm glad to be back. It's always a nice group to get back together with. It's always very moving to be part of the conference, and it's always very enriching, the discussions, and it's always a very clear reminder of why we do what we do, and it's something we always need to keep in mind. So it's an emotional time, it's a fun time, and it's always a very interesting time to discuss with everybody. It always helps to meet people face to face. Already scientists, it's always much easier to exchange, discuss, to sort of build on from what the person's saying. It's always important for scientists to discuss together, but it's also important to discuss with the patients. I think it's always rewarding for us to be able to tell them what we're doing and to get them to understand, and it's always a very good feeling. But it's also, as the patients are always so on top of things, and the questions they ask, they seem to think, oh, it's going to be too easy for you, but it never is. They always make you really think about things and put things into a larger context because they're very well read. So even discussing with them, they sometimes have really good ideas for projects or things we could look at. Research has come such a long way in the last few years. When I came to that first conference in 2008, I never dreamt that we would be advanced so quickly on so many things. However, the thing with science is you always advance, you always come up against obstacles, and you always have to address them. So I think that's the period we're at a little bit right now. We've advanced well, and there's been some obstacles, and we've just got to work out ways to get around them. So to a much shorter response is there are still a lot of things that need to be tried. I think there's still a lot of possibilities for the future. I think, like always, unfortunately, we need to be very patient with science. And I do feel that I think it's very important that I think there's been a lot of rushing towards therapies because it's important. We see the children, we see the adults, we want them to be helped and cured. But then I think sometimes we take steps and we jump over steps we should have done. And what I'm trying to say is I think we need to take a bit of time now, go back and try and understand better. And I really do think if we understand the disease better, we may have other possibilities that we've never thought of. We always have to have hope for the future. Hope is what keeps us all going, and even us scientists, because if we didn't, we'd really stop, because it's not easy every day trying to find things. Yeah, always hope. We always work from patient samples, so it's very important for us, and I always really thank the volunteers that have given us part of their samples so we can advance our research. And there's always interesting mutations, interesting genes. So I've had someone come up to me and say, would you be interested in studying our mutation? And yes, absolutely, it could be something very interesting. So there's always interesting clinical cases that we can study. I would like to say it's very important that patients are in a database and a reference database, a registry for mutations, because when there are trials, when there are therapies, that's where we go to find them. So for them, it's always very important. And yes, we really couldn't do our funding without associations like the CRF who fund our projects. It's very difficult sometimes for us to have funding from academic sources because the diseases are rare. The impact isn't as widespread as other projects, perhaps, and we rely a lot on the associations. So I really appreciate all the donations the patients make, or families, friends make to the associations, and it really is indispensable for our research. We couldn't do it without it. I know it always seems very slow for the patients, and we really do try, and we really, really have advanced, and maybe we can see it better than the people who are involved always, but the advances have been tremendous, and we always, it's normal, we always want them to be faster or more, and I hope one day we will get there. And there really is a lot of attention on CHM in the community, I find, because it's one of the rare diseases that's less rare than others. So it's, I know it's never fast enough, but yes, just patience is always essential.